Eleanor Zachariah, and this is my change project. Initiating change project ideas. To begin initiation of a change project, an idea must be developed that will transform patient care. A formula developed by Jane Felgen geared towards change is I2E2, which stands for Inspiration, Infrastructure, Education, and Evidence. Through the use of this formula, I was able to develop an idea for a change project in my own hospital. The aim of my change project is the reduction and prevention of pressure injury in hospitalized patients. Here is some of the evidence I used to develop my project aim. The burden of pressure ulcers on those living with them, on those engaged in efforts to prevent and treat them, and on healthcare resources is enormous. Pressure ulcer prevention and reduction is a high priority for the NHS. Outside of the financial cost, pressure ulcers can have a devastating effect on patients, from the risk of developing cellulitis or infection of joints and blood, to increased length of stay and a higher risk of death from associated complications. There is already $187.5 million allocated for influenza planning and response, but there are no CDC funds allocated or requested for research on prevention and treatment of pressure ulcers. What is the specific outcome? The outcome I hope to achieve is to reduce the number or eliminate the number of unit-acquired pressure ulcers. Implementing the project. In order to implement this project, I had to collaborate with my unit manager. Together we put in place a pressure injury policy. The policy is as follows. Nurses are to assess Braden scale Q shift and document in the charting system. The number they get from the Braden scale is to be written at the top of the shift report sheet. The number is then communicated to the next nurse, along with interventions for prevention for any patient who has a score of 18 or below on the Braden scale. These interventions can include turning and positioning, the utilization of our specialty mattresses, or prophylactic leave-ins. If the patient has a pressure ulcer, nurses must assess Q shift and provide ordered treatment by the physician. Documentation on the appearance of the wound must be completed each time the treatment is completed. Prophylactic leave-ins are to be placed on all patients who score 18 or below on the Braden scale. This leave-in is to be changed in the area inspected by an RN Q shift. The policy is effective immediately and was implemented on June 1, 2018. The responsibility to carry out the policy is on the registered nurses. This policy will be mandatory and considered neglect of patient care if not properly carried out and documented on each shift. Expected change and measurable outcomes. Each unit is responsible for reporting any unit-acquired pressure injuries to administration each month. The goal for our unit and change project was to either reduce the number of unit-acquired pressure injuries or have no unit-acquired pressure injuries for the month. This outcome will be measured by the amount of pressure injuries reported on Prevalence Day. This is a day in the first week of each month that an RN must assess each patient's skin and document the presence of skin breakdown. They then must look back in the arrival assessment to see if this breakdown had been present on admission. We will judge the outcome of our pressure injury policy by the number of patients reported each month having unit-acquired pressure injuries. What actually happened? Since implementing this policy on June 1, 2018, our number of unit-acquired pressure injuries has been 0. June had no reported pressure injuries on our unit. July also had no reported pressure injuries on our unit. We are continuing to implement the pressure injury policy on our unit since we have seen positive outcomes within the past 2 months alone. Evaluation of the change project. Although our unit-acquired pressure injury scores have been 0 for the last few months, we are still considering further changes. For example, a 4-eye skin check upon admission. This means that not only the admitting nurse must inspect the skin head to toe, but another nurse on the unit must also inspect the skin head to toe as well. Both nurses will sign a form that will be scanned into the patient's chart by the unit clerk that documents what injuries are noted when the patient arrives to the unit. This way, we will not be held responsible for pressure injuries that were not caused by our unit. Our current strategies have been proven effective by our results from Prevalence Day. We have had 0 instances of unit-acquired pressure injuries since we implemented our new policy. We will continue this process as it has prevented the occurrence of many unit-acquired pressure injuries. This concludes my change project. Thank you for listening.